Okay, I want to be completely honest with you and say right now that I am making this video right now out of sheer frustration. So I'm probably going to say a few things that I'm going to regret, but I'm going to say them anyway because in my opinion, this may absolutely save a life. Okay, now what we're talking about today is aftercare. And if you're not familiar with the term aftercare, that is basically the quality of treatment that you potentially could receive after a surgery, procedure, and or treatment. In this case, a transplant surgery, which is a huge deal, a really, really big deal in life. And the quality of care received after that really makes a huge difference. Now, I get it that when we're thinking about or considering a transplant center where we might be listed, therefore potentially transplanted, a lot of times people look at basically two factors. Number one, they look at volume and they say, okay, if we've got transplant center A that does 20 heart transplants a year versus transplant center B that does 150, then the 150 looks better because potentially my wait times could be shorter and there's more of a likelihood that I may even be transplanted out of that pool. Secondarily, oftentimes people will look at success rates, and typically those success rates are measured in 1, 3, 5, and or 10-year increments, and therefore they see a transplant center that has an 89% success rate versus one that has a 99% success rate. Obviously, they want to go for the 99% success rate, and those numbers are based on, again, those incremental things, 1, 3, 5, and 10 years. But what is oftentimes left out in the volume and or the percentage of success rates is the aftercare that you receive. You see, it's just not worth it to have a success rate 5 years out, because oftentimes people do. However, to have to go sheer, for lack of better terms, sheer torture to get to that. I'm seeing so many patients, way too many patients right now, they're receiving horrible, horrible aftercare. They're having to endure so many problems, so many issues, so many just I don't know what to call it, just terrible things post-transplant, because they're dealing with an inadequate, unprepared, just a sorry transplant center. That's just what it is. Now, a good transplant center will have, for example, a dedicated unit for post-transplant patients. They'll have a dedicated group of nurses and or nurse practitioners, or even qualified physicians that work those floors 24/7, that keep an eye on those patients, and they know what it is like and what is needed to properly care for a post-transplant patient. Because you see, a patient recovering from a transplant is going to be dealt with much differently than, say, a patient that had their appendix taken out yesterday. Okay, that post-surgery aftercare is so much more vital and important in that case. And if those doctors, physicians, whoever they are, nurses, the whole staff is not specially trained to deal with that, then you are going to deal with more problems, unnecessary problems, because they're going to make mistakes. They're not going to give you the quality care that is needed, where you basically got that nurse seated at the foot of your bed for the first 48 hours, monitoring you, keeping an eye on your vital signs, keeping an eye on everything, keeping you comfortable, free from pain, helping you to get up and about and do whatever you need to do in days to come. They're not doing that properly because they are not trained. They are not qualified specifically for that. You will not do well after transplant if half of the nurses on your floor in that moment are float nurses. The day before working the NICU, the next day working the ER, now they're on the transplant floor. And that is happening too much, and I'm fed up with it. I don't know what to do about it, but I know this: do not choose a transplant center solely on volume. Do not choose it on success rates. You need to sit down with patients that are at those centers right now, and some from the past, and ask them what their aftercare program is like. When you go into those transplant centers, don't go in there out of desperation, begging, pleading to be listed on their precious list. I know you're scared. Go in there and interview them and make them prove to you that they are qualified to care for you after that transplant. Make them prove to you that they have the facilities and the staff and the equipment and technology, whatever, to give you not only the best possible life far out, a year, 3-year, 5-year, 10-year, but make sure you don't have to go through hell to get to it, okay? Make sure that you get dealt with the way that you deserve, because transplant patients deserve far and away the best care in the world. Oftentimes that is provided, but lately I'm seeing too many that are struggling right now, that their lives are on the razor's edge of life and death because people are not qualified to care for them, and aftercare is not the primary importance to them. So make sure that center, make sure you check into them from every perspective. Make sure you face them face to face and say, what will my aftercare look like? Who are the people that are going to be caring for me? What special qualifications do they have that specifically make them right for taking care of a blank heart, lung, liver, kidney, whatever, pancreas transplant patient? How are they qualified for that? And then even after that, once I get in the hospital, are you going to care for me? Transplant team, are you going to care for me? Are you going to answer my calls? Are you going to take my messages? Are you going to return my calls? Are you going to call in my prescriptions the day that I need them and no later? Are you going to get me in for procedures and or tests on time, every time as I need them before this thing goes too far? Because again, too many people are getting horrible post-care, aftercare, and I'm fed up with it. So I'm begging you that if you've got an account with a certain transplant center, I know we try to be positive on here. I know we try to promote transplant centers and speak highly of them because it doesn't do a lot of good to fuss and to complain. But at the same time, we need to be educated. So if you've dealt with a transplant center and you feel as if they have made mistakes along the way that have hurt you, that have set you back, that have harmed you, start talking about them in the comments so that when people come to a video like this, they can say, okay, blank hospital, blank transplant center is not the place to go, because you're not going to receive the high quality care that you deserve after this transplant. And therefore, you're not going to have the quality of life. You're not going to have ultimately the life expectancy that you really deserve. I'm sorry I had to make this video, but please, all of you, stay stronger.